This is Pet Life Radio. Let's talk pets.
Can a certain way of eating help heal the gut of dogs suffering with IBD or other conditions? In today's podcast, I'm talking to fellow pet health coach Jessica Fisher, also of the Pet Parenting Reset podcast, who's going to share with us what she's seen about certain ways of feeding that have gotten results in winding back conditions in dogs. I'm Jody Lynn Teich, and you're listening to the Pet Health Coach on Pet Life Radio. We're going to take a short break from our sponsors, but when we return, we'll meet Jessica. We're going to learn more about what a pet health coach does, because Jessica and I are early to the pet health coaching game, and we are going to talk about these options for feeding that she's had success using. So grab that favorite beverage, get comfortable, and we'll be right back.
Take a bite out of your competition. Advertise your business with an ad in Pet Life Radio podcasts and radio shows. There is no other pet-related media that is as large and reaches more pet parents and pet lovers than Pet Life Radio. With over 7 million monthly listeners, Pet Life Radio podcasts are available on all major podcast platforms. And our live radio stream goes out to over 250 million subscribers on iHeartRadio, Odyssey, TuneIn, and other streaming apps. For more information on how you can advertise on the #1 pet podcast and radio network, visit PetLifeRadio.com/advertise today.
Let's Talk Pets on PetLifeRadio.com.
Welcome back. You're listening to the Pet Health Coach on Pet Life Radio. I'm Jody L. Teich. Is there a diet, a way of feeding that could create conditions in the body or improve or cure illness or conditions in the body? Today, pet health coach Jessica Fisher is going to share with us about rotational and elimination diets, their power, and stories about her successes. Welcome, Jessica.
Thank you so much, Jody. I'm so happy to be here.
I'm really excited you're here too, because we haven't really talked about these kinds of diets on the Pet Health Coach. So I'm excited to be sharing that with my audience. But before we dive into those specifics, tell my audience how you got involved in this, your story.
It's kind of a long one, but yeah.
Go for it.
Really, if I think back, I started out working with animals. In my mid-20s, I was doing TNR, which, if your audience isn't familiar, it's trap, neuter, return with feral cat colonies. And I did that for a while. It's hard work. I'm not going to lie. There were definitely times where it was like, I don't know if I can work with animals. But it kind of evolved over the years. I met the man who's now my husband and wasn't able to do that as much. And I started a YouTube channel about just caring for pets. And it was like really random stuff, like, how to bathe your pet and clip their nail, random things. Yeah. And one day I was also highlighting like some work I was doing with just collecting donations and helping with a rescue in my area. And some lady, I wish I could find this comment on a YouTube video, because it literally changed my life, and she has no idea. But it was just some lady who was like, it was a really sarcastic comment. Like, it sure would be nice if you could just, keep animals out of the shelters, and that way you wouldn't have to, work so hard. And that made me think.
Some people, they just don't understand. They don't understand the enormity. So
yeah. Oh, yeah. So that triggered something in me that I was like, this person, this stranger I've never met, is absolutely right. What can I do? And I decided to learn how to be a dog trainer, because I figured if I could help people with their dog's behavior problems, they wouldn't be relinquished to shelters and rescues in the first place. That was, pretty simplistic thinking at the time, but it is what it is. And so I started learning positive reinforcement dog training. I was implementing it with people. I literally worked for free as a dog trainer for about 2 years, because I was trying to figure it out. I was trying to make sure it all worked. People were getting results. And it just kind of spiraled because during this whole process, first of all, I'm one of those people that learned that I work better with animals than people. And
There's a lot of us.
yes, but the reality is we have to work with people to work with animals. That's just, something I've had to come to the realization of. But at the time, I was like, I don't know if I can do this. And I really started digging in. I had been really heavy, interested in dog nutrition because I saw what it had done with one of my animals. And I just decided to incorporate nutrition in what I was doing with my training clients. And I saw insane results with behaviors.
I totally want to dive into that. So yes, talk about that in anxiety, reactivity, and diet and health thing. Yes.
And this was before I had dug into any of the research. And of course, Dr. Connor Brady talks about it all the time. But this was before I had heard of any of this. And I'm just seeing it in person going, there is something to this. And more and more, I've just leaned heavier and heavier on the nutrition aspect, especially in social media content and things like that. And so when the opportunity came up to train under Dr. Ruth Roberts, I jumped at it. I also have my canine nutrition certification. So that's wonderful. It's just being able to help people. Long story short, I help animals.
Yeah. And we love that. And we need more people like you out there because pet parents want it. I'm sure you're seeing this, pet parents like us are realizing that what our vets are able to give us is only part of the story. Vets are necessary. To me, Western medicine, there's nothing better for ER, diagnostics, surgery. But when it comes to preventative, when it comes to cure, that's not how they're trained. And so there's a piece missing. There's a hole, right? And people who are learning about good nutrition, who are learning about the connection between anxiety, reactivity, and diet, and who are learning about complementary methods of healing are filling that hole. So it's wonderful that you're doing that. And studying with Ruth is fantastic. You're a certified pet health coach now. Why don't you explain from your perspective what a pet health coach is, does, and you said you focus a lot on nutrition, but maybe expand on that a little bit.
Yeah, absolutely. So the way I see it, and it's very much like exactly what you just said, a pet health coach is somebody who fills that gap between pet parent and veterinarian. Because more often than not, of course, somebody that's listening to your podcast or my podcast, they may have a really wonderful holistic vet that they can work with. Most pet parents in the US, and I'd say probably other developed countries, are working with veterinarians who, exactly what you said, they have been trained really, really well in setting I want to say fix broken bones, but that's not what they do either. They set them so that they can heal properly. And they're doing triage. They can do surgery. When we need pain meds or when we really need an antibiotic, that's wonderful. They can do all of those things. They can diagnose, they can run the labs and interpret them. Honestly, I think you and I can interpret the labs too, but there's the pet parent can't. And that's not to say that they will never be able to. Absolutely. A pet parent could learn all these things too. But, you go to your 9-to-5 job every day and I go to my 9-to-5 job every day. Just the difference is my 9-to-5 job is helping you with your pet. So I have a different skill set than what you do. So I'm bridging that gap between the pet parent and the veterinarian and helping them with, okay, we don't need to be so scared. I know you got a really bad diagnosis, or hopefully somebody's coming, talking to me about preventative. Gosh, I'd love that, right? But let's not jump the gun. Let's not be scared. Let's calm down. Let's breathe. And let's really assess this and see, are Western meds necessary? Or are there other alternatives where we could interject some more holistic options to the body so that the body can do what it does best and naturally heal itself. So it's bridging that gap. And I do focus very heavy on nutrition, not just because it's probably my favorite subject, which it probably is, but it is the foundation. Like, this is what you put in your body every single day, 3 meals a day, or however often you eat. And you're doing the same for your pets. It is the foundation of everything else. Every function your body performs is because of that nutrition you put in the body. So if we're not getting that right, I mean, we can supplement our way. Nothing is going to do what good nutrition does.
Yeah. It's like if you're supplementing and putting bad nutrition in the body, you're pushing a big, big boulder uphill. And yes, the nutrition's the foundation of the house, always, with us and them. And the vitamins, minerals, the amino acid profile that they need is what's telling the body to perform at its optimal level. So yes, 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 I love all of it. Let's talk a little bit about these specialized diets that you work with to help pet parents solve certain problems. Explain rotational feeding and then explain the elimination diet.
So I tend to use them in conjunction, but yes, rotational feeding is, I don't care if your dog is the healthiest dog in the world or sadly the sickest dog in the world. I think every dog can benefit from rotational feeding. And really all we're doing is changing the actual ingredients so that, for instance, one day you might be feeding beef and the next day you might be feeding quail and the next day you might be feeding, bison or pork or whatever you can get in whatever part of the world you live in. And through that, of course, that's just the main component of the meal, hopefully, is the meat. But then we can also change out the veggies. We can change out the fat. We can change out the oils. We can change out so many different things. And by doing so, we are feeding different nutrients to the body. So, somebody might look at a beef heart and a chicken heart and say they're both hearts. So they have the same nutrition. They do not have the same nutrition profile. Or even, a beef liver on a lot raised cow versus a beef liver on a grass-fed cow. Very different nutritional profiles. So rotational feeding is this idea that through whole foods, we can rotate them and provide everything the body needs.
I love that. And
Yes.
it was so exciting. I know you're a nutrition geek too, so I can share this with you. It was so exciting when I learned that every meat has its own amino acid profile, and each one is different than the next. They may overlap, but each one is different than the next. And then it made so much sense that if someone is feeding their dog beef for years, that they could develop an allergy to that very thing. Made sense to me. So I love that. I actually thought rotational feeding was more fruit one day, vegetables the next day, meat the next day, fast the next day.
There is a rotational feeding model that a woman, and I forgive me, I do not know her name, came out with that is exactly what you're saying.
Yes.
And I have heard really great things about it, and I have heard really bad things about it.
Yes.
So I have not ventured into that world. I think it's fat. I mean, to me personally, I think it's a little faddish. Maybe it could more closely resemble what an animal in the wild would do, because obviously, an animal brings down a big carcass of an animal, and they're gonna start with the organs, and then they'll get and then they'll get to the bone, and that could take place over the course of a week or so. So I get where it's coming from, and you know what? If it works for some dogs, wonderful. But no, in the context of food therapy, I think just the idea of rotating the ingredients of the diet is really what I focus on.
Yeah. Her name actually is Stephanie Kroll, Dr. Stephanie Kroll. And she's a functional medicine doctor, and she also helps pets. And she's a friend. And I actually tried this diet on my 3 dogs when I still had Jasper. And my Sophie and especially Sophie and Annabelle, they just don't really like fruit. And they really are not crazy about vegetables.
Mhm.
But because they, over like the course of a few days or maybe a week, they learn this is the way it is. One day you're going to get all these really beautiful fruits, and the next day you're going to get all these really great vegetables, and the next day you're going to get meat. They kind of went along as best they could. Vegetables, they actually ended up eating, and fruits, not so much. But it's a tough diet to maintain. And I didn't keep them on it long enough to really see if it made a huge difference in their lives. I like the idea of what you're talking about. I like the idea of switching it up. Sometimes I'll just do it in the same bowl. I'll put different kinds of meats, certainly different kinds of organ meats. There's a beautiful company out of Miami called Raw Feeding Miami. You're familiar?
Yeah.
Yeah, they have great organ meats. They really are able to source like all sorts, a wide variety. And so I will get some of the things that I can't source here in Texas from them. And they may actually make an organ mash where they have a bunch of different organ meats. So I love what you're talking about. And yes, I think it's super, super valuable. We are going to take a short break, but when we come back, I would love to hear some stories, like cases that you worked with, handled, where what you did, the choices you made with the pet parent made a difference. Can you share that with us when we get back?
Absolutely.
Awesome. Okay, so refresh that favorite beverage, get cozy, and we will be right back.
Pet Life Radio, the #1 pet radio network on the planet, joins forces with iHeartRadio to put the power of your pets in your pocket. Awesome. Download the iHeartRadio app and rock Pet Life Radio on your phone, on your tablet, on your Xbox, in your car. Pet talk, pet tunes, and fun pet times. Pet Life Radio and iHeartRadio. Positively Possum.
Let's talk pets
Let's talk pets
on Pet Life Radio.
Pet Life Radio.
PetLifeRadio.com.
Welcome back. You're listening to the Pet Health Coach on Pet Life Radio. I'm Jody Teich. And if you're just joining, we're here today with Jessica Fisher, who is a fellow pet health coach and focuses highly on nutrition, the foundation of the house. And she too has a podcast. And we're going to be talking about that as well. So Jessica, welcome back. Share with us maybe a couple of cases where the decisions you've made with the pet parent have made a difference in that animal's life.
Yeah, I'd like to think that I make a pretty big difference in all of their lives, but certainly there are some, stories, case studies that are going to stick out in your mind a little bit better. The first dog I worked with for free, of course, because I'm like a student, learning how to be a pet health coach. And he is probably one of the biggest ones for me, even though it isn't something that I did, quote, professionally. I wasn't paid for it. I was, first of all, blown away that, especially on my first real case as a certified health coach, was that the pet parent actually followed through. Like, how many times do we talk to somebody and they're like, implement this, but not that, or this is too much work, and they give up. And, you feel bad because the pet is still suffering, but honestly, it's not your fault. But that's, I was really lucky that this pet parent actually followed through and did literally everything I asked of her, no matter how difficult it was. So this was a pit bull mix who was just red and inflamed. Not an unusual story for dogs these days, sadly.
Yeah. Especially pit mixes.
Red, inflamed, itchy, had been on a mix of Apoquel and Cyto. But first of all, only 2.5 years old, had already been on a mix of Apoquel and Cytopoint for over a year of its life. This dog, poor thing, right? Because at 2.5 years old, you're looking at many, many, many more years, and you don't want to have to be on these, immunosuppressive drugs. And they're not, read the insert. They're not for long-term use, while many dogs wind up on them for the rest of their lives. And so she said, I just don't know what to do. And so we talked through it all, and we did a rotation and elimination diet. after doing a Glacier Peaks Life Wellness Scan. So that's there's a whole bunch of words that are hard for me to string together. But basically, it's just a intolerance testing, biofeedback, energetic intolerance testing. And it tests over 300 different things, many of which are different food items. Gives us a starting point. So we can say, okay, let's assume everything on this test is accurate and work from there. So we wind up with 50 different things that we need to remove from the diet, and then all these other things that we can now try in the diet. And important to know, these are suspected intolerances. Allergies, true food allergies in dogs are actually really, really rare, probably less than 10% of dogs that are quote unquote itchy, irritable, food sensitive, food intolerant. They're food sensitive or food intolerant. So what we have to do in these cases is work with the gut to help the gut heal itself and give it room, give it space to do so, using some supplementation to kind of help the body along where necessary. But most of what we're doing is food therapy. So we are rotating every single day. This dog is not getting the same thing to eat day after day after day after day. We are changing it up so that the immune system, that the body doesn't have the chance to build an attack to any one thing, because that's what it's used to doing at this point. When we talk about quote unquote leaky gut or intestinal permeability, these are food particles that are getting through the lining of the intestines of the stomach because they are so damaged and so inflamed that they're allowing particles that should never leave the digestive system outside of the digestive system. Our body, the dog's body, then says, okay, this shouldn't be here, mounts an attack against it. Boom, we have a sensitivity. So we work using food to make sure that the body doesn't have a chance to build any more of these sensitivities. And I think the reason why it's so important to work with somebody like you or me is because we really understand that. And we can advise you on that. Whereas, I see so many pet parents who are like, they go from one food to the next food, to the next food, to the next food, thinking that it's that food.
Yes.
Meanwhile, all these different ingredients and all these different foods they're feeding, we're just creating more and more sensitivities because we're not allowing the gut to heal itself. So it's really this like two-pronged approach. And that's the elimination part. We find foods that the dog can actually eat, and we build off of that. We create a diet off of that. And eventually, as the gut begins to heal itself, we're going to slowly start reintroducing some of these other foods so that we can test them and hopefully bring them back into the diet to be able to give them that really robust profile of foods that we can feed. And sadly, so many pet parents have been, we've been drilled in our heads for I don't know how many decades at this point. Your dog is going to get sick if you change their food and keep them on the same food for their whole life. And it is creating so many problems. But anyway, in this dog, let me get back to this dog. His name is Jackson. And this pet parent did everything I told her to do. And we did the rotation and we did the elimination and we supplemented various supplements that I don't want to get into because they differ for every animal. This is individualized coaching and recommendations, but we're working off of a foundation of individualized medicine. And so what are we now? We are in September as we're recording this. And this dog has been off of Apoquel and Cytopoint since December of last year. And I am just blown away because I can do what I do all day long. It's this pet parent. Like, she is the superstar here because she did it. She did the work. And even though I'm supposed to be telling you what I did, like, I'm just so proud of my clients who are doing the work. So she's really the one that I would highlight for success.
Yes. Congratulations. And I so understand what you mean because it's those pet parents that actually do the work, follow the instructions that get the results that they want. And it's so heartening because the most frustrating thing is when you can help, you're giving suggestions that have worked in the past, and they just don't stay the course. And so you're left with the same situation over and over again. And it's sad. It's sad for the dog, especially the dog or the cat. So I absolutely feel you. And I'm so excited. Skin is a very difficult issue to deal with, especially chronic skin. So the fact that nutrition alone was able to heal this animal in the way that you presented it, kudos to you. That's amazing.
Yeah, well, she did the work, like I said.
Yeah, but you laid the groundwork for her to do the work. Your knowledge transfer was really important, really important. That's what we do. It's knowledge transfer, it's resources, it's, guidance. We are, especially because these babies can't speak. They can't tell us what's wrong. So it's especially frustrating and oftentimes worrisome to pet parents. What do I do? What do I do? They're looking for answers. And hopefully pet health coaches know more than the average pet parent. So we are able through our training and experience to provide that. And that's what you did. And good for you. Awesome. What's your view on bioindividuality in pet health coaching? You mentioned something about that when you talked about supplements and not being able to get into what supplements because every pet is different, every case is different. Talk about that for a sec, because that's something that's very, very important to me and that I learn in my training for human health coaching. And I believe it's the same for animals. So talk about that.
Yeah, it's, this idea that we can have a checklist and say, X disease comes up and this is the checklist and every person and animal on the planet follows this checklist. And that, I don't know how that makes sense to anyone, to be honest. But yes, every animal is different. Every human is different. We have different genetics that absolutely plays a part in disease, that absolutely plays a part in gene expression. It plays a part in, character. We have all of these, and then we have environmental differences. I mean, my brother and I are 17 months apart. We grew up in the exact same homes and blah, blah, blah. We're very different people. How do you explain? Like there's so many different things. And then on top of that, we're eating different things and we have different, maybe your liver is going to work a little bit better than mine at eliminating toxins in the body. I mean, there are so many variables that a lot of which we still today, as advanced as we think we are, don't have the ability to calculate. It just is what it is. And so, yes, we can create programs of, I know these 4 supplements are going to be my go-to. I want to start with for hyperkeratosis or, this hemangiosarcoma, whatever it is. Like you have things that have worked in the past. Okay, that's a starting point. That's wonderful. But really customizing, especially when we're talking about the diet, I have never given 2 different animals the same diet. Like it doesn't happen. Whether that is because one animal needs, going back to like TCVM, one animal may need warming foods, one animal may need cooling foods, one animal may need liver tonics, we might need to tonify blood in another animal. So we're not going to create first of all, the same base diet for every animal, much less create the same supplement routine. And again, talking about sensitivities, because that is what I deal with so much more than anything else, we just have so many animals with so many sensitivities these days. And we have to worry about that in supplements as well. So yeah, I see so much better progress in animals when I look at them as an individual and say, for you, we're going to go with this supplement and not this supplement, even though this supplement works really, really well. And this other dog over here who has the same condition you do, well, your symptoms may not be the same, even though you have the same condition. So yes, it is all very individualized. And I just see so much better success when we do it that way. And that sadly, it just doesn't fit into our medical system as it exists today. So that's why that's why what you and I do is so needed.
Yes, agreed. There's no time in the way the system is set up for doctors to spend the time with each patient that's required to really consider bioindividuality. And one other thing that also comes up in terms of differences between animals is energetically. What is the energy in that home? You know, they're so intuitive, our animals. And the vagus nerve connecting the gut and the brain is so intrinsic in how we feel, how they feel. Most of their serotonin is, manufactured in the gut just like us. And their immune system, 80% of it resides in the gut, like us, give or take a few percentage points. But the energetic aspect is also something to be considered. So yes, there are so many variables. And I think it's wonderful that you consider that bioindividuality when you coach and, like take a case. So you have a podcast too, the Pet Parenting Reset. Tell us about it.
Yeah, I had a YouTube channel for a long time. I say a long time. I mean, I don't know, maybe 10 years now. But a couple of years ago, I just said I just wanted to do something different. I didn't see, like, there are pet podcasts out there. Of course, there are pet podcasts out there. A lot of them are very, like, I guess what I would call 1.0. They're kind of surface level. And that's wonderful. That's great. They are absolutely needed. We need to get people over to our side. Like, I want to say the dark side, but it's not the dark side.
Oh God,
really
no.
The bright side.
It's all about the light.
It is. It's really
high frequency.
It's really the bright side. But we need people like that to help bridge that gap between where I know I was 15 years ago and, where I am today. But I didn't see a ton of podcasts specifically. Yes, there are some wonderful veterinarians that are putting out really great information on, their YouTube and Facebook and places like that. But specifically on podcasts, which I have fallen in love with. Like, I want to, between Audible and my Apple iTunes, that is where I'm at, like, all of the time. And I didn't see anything that was really doing deeper dives into issues like I want to hear about. And so I started out talking about dog training because at the time that was what I was most comfortable talking about. And it very, very quickly evolved and snowballed as I started getting more and more guests on the show. I have had so many wonderful holistic veterinarians on the show, people in industry, Green Juju, Viva Raw, like really wonderful, wonderful guests, Angela Ardolino. So they get an hour generally to do a deep dive on their specific topic or on why, they do whatever they do creating their products, to help explain to pet parents like me who are like, that looks wonderful on the surface, but I don't trust anything. Do a deep dive. So that's really what it has kind of snowballed and evolved into. And I try to alternate, like, a solo episode one week and then an expert episode the following week, and kind of rotate it like that. I am getting like so many people that want to come and talk to my audience, which is wonderful that my solo episodes are becoming a little more further and far between. But I try because I really get excellent feedback, which is wonderful. But that's really where my podcast lies in the realm of pet podcasts in general.
Okay, fantastic. And where can they listen to your podcast?
It's on all the major podcasting platforms.
Okay.
I do put the video version up on YouTube and Rumble if you prefer a video version. And then the petparentingreset.com is, the main website for the podcast. So you'll find all of the episodes there.
Perfect. Is there anything that I left out that you would like to share, Jessica?
Oh my gosh. I think we could talk for days and days and days.
I know. Like preaching to the converted. Yeah.
Yeah. No, I think just, trust your gut, trust your intuition, trust your veterinarian, but, trust but verify is kind of, I think
Yes.
how we should live our lives. Trust them. They are excellent, as Jody said, at doing what they do, but it is our job as pet parents to understand what they don't do. And so people like us filling in those gaps, I think, can be very beneficial to so many pet parents. And just open up your mind and listen to your heart. And I think that makes you the best pet parent you can be.
That's beautiful advice. Where can people find you outside of the podcast?
Yeah. So my main website, where if you wanted to book a consultation with me, no pressure, obviously, jessicalfisher.com. And I generally, on the socials, I just do the Pet Parenting Reset to make it easy. So Instagram, Facebook, YouTube, it's all the Pet Parenting Reset.
Perfect. Jessica, thank you so much for being here today. You shared some wonderful information for pet parents listening and very valuable. So I really appreciate you and appreciate you being here.
Well, thank you, Jody. I appreciate you as well. And thank you for having me on.
Awesome. And thank you all for listening. A pet health coach is your champion, a bridge between you and your vet. We are empowered through knowledge, resources, accountability, and support that a good health coach can provide. So tune in next week for information, expert interviews, and tips to give the animals we love the longest and most vibrant life we can. I'm Jody L. Teich, and this is the Pet Health Coach.
Let's Talk Pets, every week on demand, only on PetLifeRadio.com.